Hello, my name is Haley Gerald, and today we're going to be discussing muscular dystrophy. Muscular dystrophy refers to a group of more than 30 inherited genetic diseases that cause muscle weakness or death. These conditions are a type of myopathy, a disease of the skeletal muscles. Over time, muscles shrink and become weaker, affecting a person's ability to walk and perform daily activities as simple as like brushing your teeth. The disease also can affect a person's heart and lungs. Some forms of muscular dystrophy are apparent at birth or develop during childhood. Some forms develop later during adulthood, but currently there is no cure for this disease. Muscular dystrophy is a very rare condition. The disease is caused by a defective gene on a person's 23rd or X chromosome that results in the failure of the body to produce a functional muscle protein. Most people who carry the gene are unaffected if it's a female, but the females have a 50% probability of passing this disease on to their sons. Muscular dystrophy often runs in families. A child who has a parent with muscular dystrophy can inherit that mutated gene that causes the muscular dystrophy. Some people have the mutated gene but don't have muscular dystrophy, and these healthy adults, carriers, they pass those on to their children who can develop the disease. There's more than 30 different types of muscular dystrophy. Some of them are more common, and those are some of the forms that I'll discuss today. First is Duchenne muscular dystrophy, also referred to as DMD. This condition tends to affect boys between the ages of 2 to 5, but girls can get it too, but it's more rare. You may notice that your toddler has a hard time running, walking, or jumping, and as the disease progresses, it can affect the child's heart and lungs. DMD is the most common form of muscular dystrophy. It affects approximately 6 out of 100,000 children in North America and Europe alike. Then we have Becker muscular dystrophy, which is referred to as BMD, and it's the second most common muscular dystrophy. Symptoms of BMD can appear anytime between the ages of 5 and 60, but typically come on during the teen years. Males are more likely to get BMD. The disease affects the hip, thighs, and shoulder muscles, and eventually the heart. Then we have what's called FSHD, facioscapulohumeral muscular dystrophy, and it's the third most common. The disease affects muscles in the face, shoulder blades, and the upper arms. Symptoms tend to appear before the age of 20. Then we have CMD, congenital muscular dystrophy. Congenital conditions like CMD are present at birth. An infant may have weak muscles, a curved spine, and joints that are either too stiff or too loose. Children with CMD can have learning disabilities, seizures, and vision problems. Then we have EDMD, Emery-Dreifuss muscular dystrophy. This condition tends to affect children only. Symptoms such as weak shoulders, upper arms, and calf muscles, and appear by age 10. Then we have myotonic dystrophy. People with myotonia have trouble relaxing their muscles. For instance, you would have a hard time or difficulty letting go of someone's hand that you was holding. The disease also affects the heart and lungs. Then we have OPMD, oculopharyngeal muscular dystrophy, and this is a very rare form of muscular dystrophy. It weakens the muscles in the eyelids and the throats. Symptoms such as droopy eyelids, that's called ptosis, and difficulty swallowing, also called dysphagia, often appear in a person's 40s and 60s. What causes muscular dystrophy? Genetic mutations or changes cause most forms of muscular dystrophy. One or both parents can pass the faulty gene on to the children, even if the parent doesn't have the condition. Rarely a person develops muscular dystrophy spontaneously, meaning there's no known cause. What are the symptoms of muscular dystrophy? Muscle weakness is the primary symptom of muscular dystrophy. Depending on the type, the disease affects different muscles and parts of the body. Other signs of muscular dystrophy can include enlarged calf muscles, difficulty walking or running, unusual walking gait, like a waddling, trouble swallowing, heart problems such as arrhythmias, or heart failure, including cardiomyopathy. Some learning disabilities, stiff or loose joints, muscle pain, curved spine, often referred to as scoliosis, and some breathing problems. Muscular dystrophy is diagnosed when your healthcare provider suspects muscle dystrophy. You and the child, or any children that you may have, could undergo one or more of these diagnostic tests: an enzyme and protein blood test that checks for elevated levels of an enzyme called creatine kinase. High levels can indicate muscle damage caused by muscular dystrophy. You would also receive an electromyography, referred to as an EMG, and it measures the electrical activity of muscles and nerves within the body. And then you would get a muscle biopsy, which looks for cell changes in the actual muscle tissue. Genetic tests can identify the gene mutations linked to muscular dystrophy. Researchers are still looking for a way to cure muscular dystrophy. Disease symptoms get worse over time, but treatments can help a person live a full, fulfilling, normal life. Physical and occupational therapies strengthen and stretch muscles. These therapies help you maintain the function and range of motion. Speech therapy helps those that have problems swallowing. Also, corticosteroids can be given, such as prednisone, that can slow the disease progression, but again, there's no cure at this time. Surgery can relieve tension on contracted muscles and correct spine curvatures. Heart assistive devices can be placed, such as a pacemaker, to treat any rhythm problems within the heart or heart failure. Medical devices such as walkers and wheelchairs can improve mobility and prevent falls, helping the person function throughout every activity of daily living that they have. Respiratory care could be needed, such as cough assistant devices, respirators, to aid in breathing if the disease process has progressed to that part. Muscular dystrophy affects your muscles, including your hearts and lungs. As the disease progresses, you may be more prone to heart problems, respiratory infections, including pneumonia, and even choking. Unfortunately, there isn't anything you can do to prevent getting muscular dystrophy. If you have the disease, these steps can help you enjoy a better quality of life. You should eat a healthy diet to prevent malnourishment, drink lots of water to avoid dehydration and constipation, exercise as much as possible, maintain a healthy weight to prevent obesity, quit smoking to protect your lungs and heart, and get your flu and pneumonia vaccines as required by your physician and annually. The prognosis for people with muscular dystrophy, since it is a progressive disease, symptoms get worse over time. The physical and occupational therapy and medical devices like walkers can help you maintain the mobility and independence for as long as possible. Medical specialists can provide therapies and offer recommendations to protect your heart and lungs. If you have muscular dystrophy, you may want to ask your healthcare provider, are my children at risk for muscular dystrophy? What steps can I take to prevent passing on muscular dystrophy gene to my children? Should I get genetic testing? What steps can I take to slow the progression of this disease? And should I look for signs of complications? And what changes can I expect as the disease progresses? It's difficult to live with a disease like muscular dystrophy that slows your limits and ability to move and function. Losing your independence can be emotionally hard on you and your loved ones. So don't be afraid to tell your healthcare provider if you feel down about this situation. Depression is a common sign of this disease. Antidepressants, counseling, and support groups offer help and hope. Your healthcare provider can also recommend therapies and medical devices to help you maintain your independence for as long as possible. Like many other disorders, understanding and education about muscular dystrophy is the most important tool to which to manage and prevent these complications. At the end of this, I'll provide a slide of different organizations that you can provide more information about muscular dystrophy. Thank you for your time.